Hello, so today I'm going to do the video on Unit 3, Self-Care. So we are going to start by looking at the slideshow. So everything starts with the slideshow. Slideshow is your eDynamic answer key. So if you read the slideshow and or listen to the podcast, which is essentially the slideshow in audio version, that is posted here. Right here is the audio version, the slideshow podcast. You can either read it, peruse it, or listen to it, or do both. This is what you're going to learn if you have successfully read and or listened to it. What you're going to learn is the types of diets and the impacts that they have on health, the healthcare safety measures such as hand washing, donning and doffing PPE, proper spill cleanup techniques, analyzing chains of infection, modes of disease transmission, discussing major scientific advancements and their impact on healthcare. So your first chapter is going to be taking your health into your own hands. So in the introduction, it talks about the plagues of cholera and rushing through parts of London, and then how did that have an impact on health and safety and the population. Um, cholera is a bacterial disease typically spread through water. And within a few days of pump removal, there were no new cases of cholera. So this talks about what the city did to help with that. And then an ounce of prevention. What can you finish the saying? You have an ounce of prevention is worth a pound of a cure. So preventative care is kind of important, and that's what a lot of physicians deal with. So some common things that a doctor will look for during a checkup include high blood pressure, obesity, tobacco use, depression, and some diseases such as diabetes. If a doctor finds evidence of any of these things, they will order further tests or send you to a specialized doctor. Okay. So developing healthy habits. While attending your medical checkup, your primary care physician will also discuss healthy habits with you. So healthy eating a variety of foods, including lots of fruits and vegetables. And of course, you may ask about your health. The more you know, the better able you are to take care of your body. Chapter 2, you are what you eat. Whether you do it or not, most people will agree that it's important to visit the doctor once a year for a checkup. And everyone knows that staying active and exercising helps you stay healthy. So participating in gym class is important. Okay, so now we're going to take a look at some well-known diets and hear what the government agencies in charge making some nutrition recommendations. So this is what's in your lunchbox. These are some things that you should do to follow some dietary guidelines. So follow a healthy eating pattern, shift to healthier choices, limit added sugars, saturated fats, and salt, focus on eating many different foods, and support healthy eating habits for all. Okay, so you want some protein in your life, and this is a good start for everyone, but everyone's just a little bit different. So low sodium diet, diabetic diet, mechanical soft diet, and just a regular soft diet. So this kind of tells you about different types of diets. And then diet and disease, what the USDA and the HHS recommend. Eating your veggies. I know a lot of you don't like to do that, but they're important. Choose whole grains. Obesity is the one condition, being very overweight with lots of body fat. Body fat is linked to poorer health and increased disease risk. Just say no to sugar and salt. I know that's really hard, but you can, limit the amount that you eat. Instead of eating 5 donuts, you can just eat one. Next one is not feeling well. Chapter 3 talks about not feeling well. We've all been there right now. What can you do about that? So when you're sick, you stay away from others. You keep your body, the viruses move through your body. Um, so decide, are you contagious? You don't want to pass it to someone else. Stay home when you're sick. The flu, the portals of exit where the virus can leave your body and get onto someone else in your mouth and nose. Mode of transmission, the way that the virus passes from one to another is through small saliva droplets. Okay, portals of entry, that is when they enter the body of a new host. That's called the portals of entry. That's going to be in an assignment that you need to do. And then a chain of infection. No. So those are things that you're going to work on in another assignment. Okay, so spreading the disease, you stay contagious for 5 to 7 days after you get sick. So for that entire time period, you could spread the disease of the flu to others. And all of the people that you spread the flu to will be able to spread that to someone else. So you don't want to spread that. And this is teaching you how that happens. So staying healthy, this is how healthcare workers stay healthy. They focus on using those PPEs to keep those droplets of their water droplets from their mouth into themselves. Direct transmission is when an illness is spread by skin-to-skin contact through droplets. Many of the illnesses you're familiar with are from direct transmission. Okay. Indirect transmission is when an illness is spread without direct contact. There are 3 main routes of indirect transmission: airborne, vehicles, and vectors. Airborne is when an infectious particle is carried through the air by dust or very small pieces of dried droplets. Vehicle is when an illness is contracted through food, water, or objects, like used Kleenex. Vector transmission is when another living creature carries the infection particles but is not impacted by them, like a mosquito carrying malaria. Okay, more about how workers use PPE. And donning, right here, if you know how to don or put on a mask. Okay, so donning means to put on. Okay, here's a video to help you understand how to don and doff PPE. Okay, doffing means to remove your PPE. All right, here's information on that, how to take off. This is going to be an actual assignment, so this is references for that assignment. Okay, so again, this is a reference poster on how to wash your hands. This is going to be an assignment later on. So this is where a reference point for that. Okay, so this slide talks about the environmental services and how they're responsible for making sure everything's cleaned up, everything is nice, properly, how to clean up spills, bodily fluids, and disinfecting door handles and light switches so that everyone stays safe and healthy. And then vomit in room 8. This is, a patient came in nauseous and vomited. How are they going to clean that up? So this talks about environmental service workers and how they are cleaning that up. It's never fun to get sick, but when you come down with the flu and you pass it to others, it is important to stay away from people. That's why it's important to stay home when you are sick. Okay. The next chapter talks about stopping the spread. Next time you get the flu, you decide to head to the doctor's office. get a prescription to feel better. There is no cure for the flu, but there are medicines that will make you feel less sick. Testing and identification. There are vaccines is a treatment that trains your immune system to fight an infection. The CDC will track your case of the flu and categorize it based on the part of the country you live in. Tracking a disease if it's an epidemic or a pandemic. Pandemic is what we had with the COVID vaccine. Epidemiologists collect the type of public health. And then where did the outbreak start? With contact tracing, we did that with COVID. And then discovering new methods. And you have vaccines and hand washing, and modern anesthesia and organ transplants, penicillin. And then now it's time for your knowledge check. We have our questions. If you answer the questions here by looking back, getting the answers before you do the knowledge check for a grade, that way you can get a good answer, good question, the right answers. And then the conclusion. So then our assignments, here's your podcast again. And then these are the assignments. We'll look at those. Your critical thinking questions. Again, all of these answers are in the slideshow, so you can refer back to them. Caleb's grandmother found out she has diabetes, must make some changes. So go back to that first chapter about diet. What changes should she make for a diabetic diet? Question 2, getting cut on the leg or an infected tooth could lead to death. What important scientific advancement made these less dangerous to humans? Okay, go back to the bacterial infection. Go back to that section in the slideshow and see what has been discovered to help with that. Neville has a dry cough and a high fever, general feeling weak all over. Besides being prescribed treatment, he's told to stay home and rest. So explain why he has to stay home, why the doctor wants to know who has been around. Okay, sounds like contract tracing. And what is this called in the medical community? Okay, go back and check that out in the slideshow. Number 4, imagine that a patient has come into an emergency room with a headache. They're given a hospital pillow to rest their head on. Okay, later the patient is diagnosed with a contagious disease. Based on what you know about modes of transmission, explain why the job of the environmental services staff is important in a case and what might happen if they did not take their job seriously. Okay, that person is contagious. Okay, what's important about that? Number 5, even though doctors are there to help us when we get sick, sometimes we have to take care of our own bodies so that we can prevent sickness. Okay, write a paragraph showing how you would convey this information in a way they understand. Elementary school class. Okay, so go back to that chapter if you need help with that. Discussion questions. Again, you can use the chapters to help you with that. So dietitians. All right, talk about the soft foods, the low sodium diets. All of that is in the slideshow. And then number 2, recent years, there's been an argument about effectiveness of vaccines. Okay, we talked about vaccinations in the slideshow. Again, 2 statistics to support your opinion. Those were listed in the slideshow. Okay, so activity 1, follow the chain. You're going to, here's the worksheet for it. You're going to create a poster using some information that you are researching. You're going to choose 2 contagious diseases that are interesting to you, be it the flu or a cold, or say COVID, or a sinus infection, something that you have had or that somebody has, whatever. and then you're going to think about some information. You're going to find out whether those two diseases are caused by viruses or bacteria. Find out if the germs, how the germs got into the body, what does it do when it gets there, and how does it get passed on to someone else. So once you have your two diseases figured out, then you need to answer those questions about those two diseases. So make a list of what those are. And then what you're going to do after you get your information, then you're going to create a poster for those two diseases. So I want two posters, one for each disease. Okay. And then you're going to follow so you're going to pretend like you're going to put those up in the medical clinic. All right. So one would be, say, the cold, and one would be the flu. And you're going to do an illustration of how they get into your body, portals of entry, how they come out of your body, how they're transmitted, and then the portals of entry to the next human. All right. And you can use different colors of fonts to make your digital poster catchy to the eye, organized so that people will understand how it works. All right. So basically, you're going to create an informational poster about two different diseases, how you can catch it, how it can be caught by the next person. You can use Canva, you can use a PowerPoint slide, just have it go up and down instead of side to side. You can use a Google Draw, you can do a Google Doc, you can add some different docs or screenshots or whatever you need to do to help you with that. Okay, so that's this one. Your next assignment then is your outline. All right, and that is, let's have a look at that one. You are going to think about some of the dangers that exist when you get sick. People with a contagious illness in your medical facility. Okay, so what type of precautions should medical personnel take to keep safe? All right, we talked about this in the slideshow. All right, you're going to create an outline of some key precautions that you should take to protect patients and healthcare workers. So your outline is going to make a note of each precaution. So under each precaution, you're going to write a brief description of how this protects everyone. Note at least one point that you learned about how to correctly perform each task, and then one caution, what not to do that must be remembered while performing each task. So, for example, you're going to wear a mask so that you don't catch their droplets in your mouth, in your nose. You're going to wear gloves so that you don't get their droplets on your hands and then touch your eyes. You're not going to touch your face with your gloves, because then you're going to put whatever you touch on them on your face. So those are some things. And again, this is all in the slideshow under PPE and say how to protect yourself. So as a reminder, so you're just going to create a simple outline as to what you're going to create, what precaution you're going to take, and how you're going to perform those to make sure that they're going to keep you safe. Okay, so washing your hands, wearing PPE, keeping the facility clean. Those are some of the things you can do for that. All right, just a simple outline is all you need to do for this one. All right, the next activity is a video. Use Flipgrid for this. And again, I know some of you don't like to do videos, so you can modify this assignment for that. But this is an instructional video for healthcare workers who have been newly hired. You can use some props. This is 3 videos. One is hand washing. So you can go to the bathroom at Sudlow and put your phone down or your computer down next to the sink and talk while it's watching you wash your hands. So you can you know, walk them through the steps on washing your hands. So that would be how to do it. You don't have to like show your face. You can just say, okay, first I'm going to put the, you know, get the soap. Then I'm going to, you know, I'm going to wet my hands first. Then I'm going to get the soap. Then I'm going to scrub my hands for 20 seconds. Then I'm going to rinse my hands thoroughly. Okay. Then I'm going to dry my hands with the air dryer and then let me hear the air dryer go. Right. So that would be a demonstration on washing your hands. That's all you have to do on washing your hands video. Okay. Then you're donning and doffing. That's basically putting on your PPE and taking off your PPE. We have masks. You can ask the school nurse for a mask. You can just do gloves. You can use your winter gloves for the pretend that it's PPE. If you want to use pretend you have a gown on, you can use anything like a shirt. Put a shirt on, a button-up shirt on backwards with the buttons in the back. You can pretend that's a gown. So anything like that, you can pretend that that's backwards a gown. So any of that, that's your donning and doffing. So that donning is putting it on, doffing is taking it off. Okay. So there are videos in the slideshow that show you how to do that. So that is basically what that is. And if you don't want to do a video, you can make a poster on how to take them on and off. Okay. Cleaning up bodily fluids. Again, this is how do you clean up a vomit? How do you clean up dangerous bacteria? Someone else. How do you clean up blood? How do you clean up, you know, a spill from someone? You know, someone's just coughed all over the table. How do you clean that up? If you don't want to do a video, you can make a poster instead. I'm okay with that. Same with all three of these. Okay. So if you are shy and don't want to do a video, you can do a poster. All right, I'm okay with that. So as long as I have 3 different ones for each of these contexts, you're okay with that. And then should be the last thing is the quiz. Please use the slideshow if you need to make sure you do the quiz correctly the first time. Otherwise, you're going to have to do it again. All right, hopefully this helps and good luck. Look forward to seeing your work.